Do you understand that question?
I don't really get the question, but I will try and answer it to the best of my ability. And if I didn't answer it correctly, the person can write the question.
Yeah.
So I'll start from the end because that's the most I remember. So do I feel I'm missing anything? I'm hoping the person is trying to ask me if I'm missing anything from the people that are now medical doctors instead of nurse practitioners.
Probably.
For nurse practitioners, I don't know if I went into what we do. So in the United States, we are what we call the mid-level providers. So we work mostly like doctors. You know, we see patients, and depending on your specialty, I actually work with cardiac thoracic surgery. So I'm a surgical nurse practitioner. So I don't really think I'm missing a lot. Of course, I don't do surgeries, but I do a lot of things pre and post surgeries for my patients. And most patients, you know, the doctors would back me up on this. Also, mostly the nursing bedside manner more than medicine. I don't know if Dr. Badmus and
I agree with her.
They can back me up on that. So most of the time, if my patient comes in and they see me or they see the surgeon, they always prefer to talk to me. So I don't know if I'm missing anything. I can't say because I've never been a surgeon. But I love what I do. And what else was the other question? I think I started from the end.
Broken bones.
The other question was how much exposure have you had with other organizations? So, apart from where you've worked now, how much experience have you had, basically? I think
I've had a lot of exposures because I've been a nurse for about 22 years now. I started in acute care. I've also done home health care. I've done rehab care. I've done intensive care units. So the only thing I've not done is pediatrics and women's health, which is like maternity. That's it. But everything else I've done psychiatry. So I've had a lot of exposures.
Perfect. Thank you. So I guess from what I get from what you're saying is you're 100% fulfilled doing what you do.
Yes, I am. I didn't think I would be. I thought, like we said, we're just doing this for a short time, but I've done it for more than 20 years now, and it's been an amazing journey. It's been a journey that, you know, it's you could do anything because we're also shift workers. You know, you could juggle family and work together about 100%, and you would miss very little. So it's an amazing profession.
Perfect. Thank you. Thank you for that. So just for any one of you, what would you say? I know for both of you, for all three of you rather, it came naturally for you guys because you were already in the sciences and you just felt like, well, I had no choice but to become someone in the health profession. But what would you say is there any sort of inner or any skill set that if you're maybe 17, 18 years old that you should be able to identify that would help you thrive as a medical practitioner? Is there any sort of soft skill or skill set that would make you, if you have a decision to make, for example, do you want to be an engineer? Do you want to be someone in the medical profession? What's that thing that you say, if you have that, you should go for it?
For me, I don't think there's really anything. Like you said, it's you know, you have to have just it's like for everywhere. I don't know about the people in South Africa, but I know in Nigeria and I know in the United States, you have to have your sciences. You can be in history and do medicine in any form. I mean, you could in the United States. I know people that did Christian knowledge, but you still have to have your classes, you know, the biology, the physics, the chemistries. You still have to have that. Maybe you just didn't major in chemistry, but you still have to have all those classes. So no matter what, you have to be good in your sciences. So if you're not like apt to those classes, you just have to, if you feel that you have to be something in medicine, I think even a physical therapist, occupational therapist, all those things, you still have to get those classes down pat. And people will say, as nurses like me, they'll say you have to be, you know, kind and all of that, but that doesn't really have anything to do with being a nurse.
It's a good soft skill though. It's good to have that customer service. I'll blame the doctors. I'll generalize here. Doctors don't like two things. Doctors don't like customer service, and they don't like IT. Because I worked with doctors for a while, and when you introduce technology, they're like, no.
But the world is changing now. So we are planning surgeries on the computers now, and we're taking dimensions and we're making adjustments and we're running trials on our systems before we go to the theater to do anything. So if you're not learning the IT thing, then you're going to be left behind very soon. So people are starting to realize that. And then talking about the soft skills, I think the world is gradually changing now from that God complex that you would have as a doctor. Because right now, a patient is not satisfied, they sue you and they sue you for everything, and you lose your license and you lose everything because you were nasty. Anything can go wrong with medical practice. You could do a surgery and it can go wrong. The difference between the person who goes to court and the person who doesn't go to court is their perception of how you as a caregiver or as a practitioner handled the situation. So if you showed empathy and you carried them along and you counseled them properly and you listened to them when they had complaints, even when the outcome is not good, they're kind of like still happy with you. You know, they're like, doctor, you did your best. Thank you very much. You know, but if you're those people that never have time for them, they always try to see you, you never talk to them, you're always snobbish, you're always in a hurry, you know, you kind of like talk them down or you dismiss their concerns, then pray to God that it goes well. Because if anything goes wrong, then they're going to have you for it. So I think that people are forced to learn soft skills right now. You know, that's what I think. I think that everybody eventually is going to be a nice person. You don't have a choice.
Not just the nurses.
No.
That empathy is very important, and that's where my specialty plays a great role. As Kemi say, I speak, or I convert doctor speak to human speak, and put it that way. So, I had a patient who came to tell me last time that, you know what, that specialist you sent me to seems to be more concerned about my kidneys than me myself, you know. So I try and convert the doctor speak to simple language that the patient will probably understand. But I guess, as Dr. Hakim says, that empathy is very important right now in our practice. Even here in South Africa, even though I work for the government, it's it's important. It's very important. Yeah.
Perfect. Thank you. We have another question from Joy Ibok, and I think I'll just throw it out to the floor. Not to the floor. I think I'll throw it out to probably Kemi and Dr. Badmus. So it says, how easy is it for a middle-aged Nigerian trained medical practitioner to settle and work in the US? Any advice? So middle-aged,
middle-aged. Who are the middle-aged?
I guess
25 to 45, right?
Yes, I think so.
I it depends on what you are. If you're, let's say if you're a nurse now, if you go to somewhere like the United States, you can easily write your boards. And then with nursing, if you pass your boards, you're fine. But with medicine, if you pass your boards, you have to do residency. Let's say you're done with your residency already in Nigeria and all that. So you have to factor all those things in. And something like dentistry, they don't recognize dentistry at all in the United States, the Nigerian dentistry. So you have to start all over again. So you have to start from like year one of your medical school. So that's where it becomes a little tricky, but it depends. It's there's no blanket like thing that you just have to do. But for every sector, it depends in the United States. But for all of it, you have to pass a board. And from the board, then you can do whatever you want.
Yeah, so I've actually counseled quite a number of people on this subject, and I've seen people go through successfully different angles. Number one, if you want to start this journey, make sure that you have time on your side. It's not easy starting this journey in your 40s, you know. It's a journey that you're going to meet a lot of young people in the place you're going. You're going to have a boss who is 32-year-old, and it's not going to matter. You're going to have colleagues who are 21, 22, you know. So you have to know the setting you're going to go and fit into. And then you must have the energy and the time to read. So the first thing you're going to do is you're going to have to write the USMLE exams. And the USMLE exams requires a lot of preparation for you to go into it. And it's best to pass it the first time, because every time you write it again, it counts against you. Such that even if you write it the third time and you're like the best in the whole world, you'll still be rated lower than the person who is writing it the first time. And maybe he's in the 80th percentile or something like that. So that is where you're starting from. Then having passed that exam, the next thing you need to think about is what you really want to go and do there. So you must do your background research. There are some specialties that are worse than a camel passing through the eye of a needle. So if you're headstrong and you say you want to go into those specialties, it's going to take you longer. But there are some specialties that they're looking for people to come on board. And, you know, it may be easier for you to apply for a match and get a match because they never fill their quota for that particular specialty. So the specialty is important. The state you're applying to is also important, because every state has its own laws and, you know, their boards and their criteria as well. So it's more than just writing an exam when it comes to doctors. It's a lot of research. It's a lot of communication with people who are in the field you want to go into. It's a lot of finding somebody who's going to mentor you in the path that you're going into. And then you can now decide that you're going to go in there. Then, but more importantly, how determined are you? Because you're going to get discouraged somewhere along the line. So the difference between success and failure is how much you're willing to persist in the face of adversity. So when you meet all the challenges, when you don't match this year, when you're having to apply to 50 different schools, and that's a lot of money, if I'll tell you that, you know, you have to ask yourself, do you have what it takes, enough fuel inside of you to push through the whole journey, so that you don't waste your time halfway and then you drop back, you know. And that's the reason why a lot of people probably ease themselves into the United Kingdom, because it's a little bit easier in the United Kingdom. Just write the Club 1 and Club 2, and then that is all. And then you go in there, you start as, you know, an SHO, and then you get into something somehow. But it's not like that in the United States. You're going straight into a residency program, and you must match for that program. So yeah, nobody would say it's easy. Yeah.
But it takes being persistent, like you said.
Yeah, it does.
Perfect. Thank you very much, guys. I think this has been quite interesting. I have one final question. Maybe Dr. Etan can start. It's a lighter question. What do you guys think in the medical profession about Google doctors? So people like myself, a patient, I'm coming to see you now. I do a lot of research. It might be rubbish research, but I do a lot of research, and Google makes me feel like I know more than the doctor. Because I've been to see a doctor once, and I was saying things like I knew, and he was like, "Dude, relax. I'm the professional here." What do you think? Do you think it's helpful for patients to come armed with too much knowledge, or is it better to sort of take the lead from the actual professionals?
Well, that's a very interesting question, and yes, you're right. It's really growing right now. I remember when I first started encountering that, I had a paternalistic approach, as where I grew up in medical school from Nigeria. I'm the doctor, I'm the boss, I'm an expert about everything regarding health. But I've come to understand that while I might be an expert in terms of the science, the patient is an expert in terms of how she experiences the illness. So I come and listen to what they say. I'm open to people coming with what they've heard from the internet, yes. But I'm now trying to build it contextually to the person I have in front of me. So I hear what you're saying, but now let's talk about you as an individual. So do I get threatened by patients who come with diagnosis from the internet? No. I have the knowledge to put that knowledge that they got it from the internet and contextualize it for they themselves. So right now, I'm no longer threatened by Dr. Google. as
Dr. Google.
Previously before. But Dr. Akim, what's your experience like?
Yeah, so yeah, there's always this patient who comes in and tries to let you realize that they've read it all, they know it. This is my problem, like I read it and it just matches everything that I read. And you're examining them and you're thinking that not quite, like what Google didn't tell you, or maybe what you didn't research enough, is that there are 20 other things that could cause this same problem. What I would normally advise people to do is to see the doctor, get the doctor's opinion, and then you can go and read around it and understand what he has said. I think that you would be better informed when someone tells you that you have maybe a polycystic ovary, and then you go and you read about a polycystic ovary, rather than you type in abdominal pain on the right side, and then it now brings up a whole lot of junk that is the cause of abdominal pain on the right side. And you didn't even realize that what you had was a polycystic ovary. So what I would say is, yes, knowledge is important, but guided knowledge is where people should focus on. So it's not good enough for you to be ignorant about your disease or the condition you're having, and even the medications that you're taking. I like patients who can read around the medications that they're taking also, because I don't find it interesting or pleasant anymore when I ask the patient, what drug were you taking? And say, I don't know the name. He just gave me one yellow pill and he gave me one white pill. And I'm like, come on, in this day and age, like, you should know what you're taking. You should know why you're taking that drug. You should know what that drug is meant to do in your body. You don't just come to me and I'll write 5 drugs for you and you go away and you say, doctor gave me 5 drugs. No. Like, why am I taking 5 drugs? There must be a reason why I'm taking 5 drugs. And is it something that 2 drugs can't do? So it's, oh, this one is a muscle relaxant. Oh, this one is for the pain. Oh, this one is for this. Oh, this one is for that. So it's important that we read around the context of what we've been told by our healthcare givers, rather than just going to Google and just, type search. That's what I think. Yeah.
Kemi, any words from you?
For me, because my background is nursing, so we always teach our patients to be the best advocate for themselves. But with them being the best advocate for themselves too, would tie up what Dr. Etang and Dr. Badman said together, you know, not to be afraid of what they would ask you, like, okay, I read it here that this is what I have, but like, okay, I know that this is what I have and this is what I think we can do. But most importantly, what we tell them is like, please do not put it on Google search. Do not go to WebMD. Don't do it. We actually put all, you know, put those, the website they can go on to read about it. But like Dr. Badmos has rightly said, you have to know what you have first. You can't just search something and think you're having a stroke because you're having a headache. You know, you can't do that. You can't come into the hospital and like, oh God, I think I have this. No, somebody that is knowledgeable has to tell you this is what you have, and then you can, you know, educate yourself more. So that's it.
Perfect. Thank you. Thank you very much.
Thank you.
I'll hand over now to Hope for her final statement or words for the day.
Yay. Thank you, everyone. Like Toby said earlier, I always like saying thank you. Thank you so much. Thank you, Dr. Badmos. Thank you, Dr. Etang. Thank you, Nurse Kemi. I'm so grateful. And of course, Toby Lola Patilewa. I love to call his full name. Thank you, everyone. I'm grateful that you're able to make it here. And we trust that this will be helpful to those who were not even able to participate, because as we had earlier said, this will be put on YouTube. And so from years to come, other people would learn from what you have shared. So we always have this session, first Saturday of every month with a different theme. And our next theme will be information communication technology, my career growth in the international space. Toby suggested this theme. So we are asking that you also share this with your friends or those you know are into ICT. Actually, this sessions started off with a targeting the young professionals. But as time went on, we realized that actually everyone learns from everyone's experience. And I get to learn from every session we have here on. And I've learned from the lawyers, now I've learned from the doctors, I've learned from everyone. And I believe this can work for anybody, because like I got to learn today that sincerely, not as if I didn't know, but the kind of friends you keep, that's Dr. Badmos said that. Friends always keep good friends, always keep people who will be ready to even talk to their parents for you, who will be ready to talk to a friend for you, who will be ready. Just be nice to everyone, be good to everyone, because we need each other to be able to grow up the ladder. Thank you so much, everyone. And we hope to see you next month, 3rd July, by God's grace. And please invite your friends and those who you know that would can learn from this, and those who you think wouldn't even also be interested, but maybe they would also learn. They could also learn from our sessions. Thank you, Kemi. Thank you, Dr. Etang. Thank you, Badmos. Thank you, everyone. I'm so grateful. Thank you, everyone, for joining. See you another time, and see you soon. Yeah.
Yeah.